Hi everyone, and welcome to today's presentation in our Collegiate Recovery series. My name's Olivia Pinelli and I'll be your host today. We're joined by Dr. Jonathan Lofgren from Minneapolis College, who will discuss Minneapolis College's CRP. These webinars are hosted by the Association of Recovery in Higher Education in order to support the growth and development of the collegiate recovery field. But before we get started, I just want to go over a few logistics. Today's webinar will be recorded, and as you may have just caught, we are uploading to YouTube and we'll later post this on the ARHE website, so you'll be able to go back and access all the information. If you have any questions for our presenter, please put them in the Q&A box at the bottom of the screen and we'll get to as many questions as we can. If there are supplemental materials, such as the presentation that you want access to, we can provide that afterwards. If you're having any technical difficulties, contact all panelists and Sylvia and I will try and resolve that for you. We're always looking for ways to improve and new topics to cover. So if you have any feedback, attendees, please reach out to us and let us know. So I'm about to turn things over to Jonathan, but I just want to take a moment to read his bio. Jonathan Lofgren is a native Minnesotan, holds a PhD in education, specializing in training and performance improvement from Capella University. Jonathan is a licensed alcohol and drugs counselor and a co-occurring disorders professional. He is an active member of ARHE and International Motivation Interviewing Network of Trainers, and a lifetime member of the NAACP Minneapolis Chapter. Dr. Lofgren has 30+ years of long-time recovery, behavioral health and education experience, and is a faculty member at Minneapolis College and Metro State University. Jonathan is the founder of the Collegiate Recovery Program at Minneapolis College, the first CRP and community and technical college in Minnesota. He also created older graduate schools, co-occurring disorders master's degree specialization, and Minneapolis College students African American Brotherhood program. So I'm going to turn things over to you, Jonathan. Thank you.
Thank you, Liv, and thank you, Sylvia, for helping coordinate and get everything together. And thank you, ARHE, for having me and for spotlighting Minneapolis College as a webinar. So hopefully today we'll be able to share with you a little bit about our collegiate recovery experience in establishing a very active collegiate recovery program in a community college in Minnesota, and talk a little bit about some of the history, the development, and the context of the program and how it functions. And then we're excited to also have a few of our members, both from the staff side and from the student side, share a little bit of their perspective about the program with you all as well. So you won't just have to hear me go on and on for the whole discussion. I'm super excited to get the perspective across to ARHE and to the community beyond my own perspective and hear from some of our students as well. So, and my co-founding partner, I get all the credit, but my co-founding partner is here, and that's Tara Martinez. She's been just as responsible, maybe even more responsible for us having a collegiate recovery program than I have been. I am fortunate and privileged to also be a member of the board of directors of ARHE. So I suppose I should give that disclaimer. I don't think that's why I was invited here, but it's an awesome privilege to be serving the Midwest region and the country as a whole in terms of collegiate recovery, in terms of collegiate recovery. So I'm about to pull up my screen share, and then we'll look at a few slides. I'll go over those slides briefly, and then we'll take it from there. And this is the presentation that Liv said we could definitely make available. So, and I'll just make sure that it's functioning well. So I'll look for a thumbs up in just a minute to make sure that the slides are progressing through as well. So did it go to the second slide? Somebody? Okay, good. All right. Anyway, so we'll try to spotlight our collegiate recovery program, talk just briefly about a couple of points. We feel like maybe justified having a collegiate recovery program, and that seems to be something that's important if you're going to start a new collegiate recovery program, is you have to tell the institution why you should have a collegiate recovery program, as if just supporting students in recovery isn't enough. There might be more reasons to establish a collegiate recovery program at your institution than just the mere fact that supporting students in recovery is a way to expand on equity and access for diverse student populations, but also people are often interested in things like prevalence and how significant the problem is of, say, substance abuse problems or recovery, gaps in recovery, supporting students in recovery, what those gaps might look like at your institutions. And when I said points of light on the agenda, of course, that's hearing from some of the other people that are involved in our program. And I thought that people are really interested in knowing how collegiate recovery programs have made it through the pandemic, because the pandemic of COVID-19, I think, has taken a huge toll on collegiate recovery programs all across the country, at least from some of the people that I've talked to in various parts of the country that have collegiate recovery programs. It's like, man, it really was this like cliff we all sort of fell off of together in terms of how to engage folks and keep people engaged during this pandemic, when so many institutions and campuses shut down or went to sort of minimal, contact with people, face-to-face stuff, and all this distancing and everything going virtual. It's just been a big challenge. So I thought we'd talk about that for a minute as well. And then, as Liv said, we'll definitely take questions and comments, both as they might show up in the chat room, and also carve out a few minutes at the end. So this letter that was put out by the federal government from the White House of National Drug Control Policy, the Department of Health and Human Services, and I don't know why it went forward by itself, and also the Department of Education. One of the things that this joint announcement or letter went to all universities and colleges in the United States, said that these institutions would respectfully ask us to consider adding collegiate recovery support to our campuses. So there's almost 6,000 colleges and universities in the country, a little more, a little less, somewhere around that number. And I think maybe there's 200, 250 max collegiate recovery programs. So you could do the math. It's definitely not 10%. It's definitely not 5%. It's like 3 or 4% of colleges and universities offering specific recovery support services on their campuses for people in recovery from substance use, and oftentimes co-occurring disorders is also included in the umbrella of services that our collegiate recovery programs try to support in their students. Lots of campuses have health clinics and initiatives to help students with drug use problems, intervene with them, refer them off of their campuses, student conduct issues, and the like. But very few campuses have supports for students that are in recovery, that have done something about their substance use problems and then want support so that they can thrive and feel supported in this particular area while they're going to school. So I think this was a big statement that came out from these joint government entities. So just turning my mic down a little. So what is collegiate recovery? Well, I'm guessing everybody knows what collegiate recovery is. And the difference between the community, a collegiate recovery community, and a collegiate recovery program, sometimes people are talking about the same thing when they say a collegiate recovery community or a collegiate recovery program. sometimes I sort of think about it as, well, what's the campus culture, like the whole institutional culture? Is it supportive of the notion of recovery for students, so like supporting students in recovery? Do they do anti-drug and alcohol use stigma campaigns? Is the culture and the environment of the institution supportive? And then in the collegiate recovery program, like specific services and activities designed to support students in recovery. So that's kind of at least one way to have a distinction. But again, you might just use that terminology sort of interchangeably, right? So, and then TYR and other, there's other foundations that support recovery in higher education. But when we were establishing our collegiate recovery program here at Minneapolis College, we were involved with Transforming Youth Foundation, and then we actually received some seed money, a very small grant, to help us establish ourselves and have a few dollars of resources that went beyond the institution's commitment to establishing the program. And so we actually applied for our grant before we established the program, and then we didn't get the grant till after the program was established. But this was also some research that was conducted by TYR, Transforming Youth Recovery Foundation, that focused on community colleges. And when we joined TYR, I think we were the 6th community college that was also a member of ARHE. And right now we're the only Midwest regional member that's in a community college. The ARHE college or institutional member that is in a community college in the entire Midwest region, which covers like 7 or 8 states. I mean, it's a huge region of the country. And there are more community colleges that have CRPs in our region, but they're not members of ARHE. So this distinction about being a member of ARHE also carries with it a few privileges that might be important for you to consider. Like, you have this network of programs and communities that can help you build your own collegiate recovery program. And you also have that sort of advocacy power that comes behind being affiliated with an association like ARHE. So at least for institutional consideration. The other thing is, I think students find benefit in the network across the country of hearing about, meeting, seeing, connecting with students in recovery from other institutions. It expands the network of possibilities too for students to pursue different levels of education at other institutions across the country that have recovery support. One of the things that was most exciting about our development early on was when the first student that became a member of our collegiate recovery program said they came to our college because we had a collegiate recovery program. We had other members in our CRP, but when this person said that's why they came to the school, I think all of us were jumping up and down, in celebration. Like, students are coming to our little community college in the middle of Minneapolis because we have recovery support. And that is just so exciting. Anyways, the other thing I wanted to highlight too is in the research, there's a link at the bottom of this slide, and that connects you to the actual article, the research article from TYR. But that article was also converted by the Collegiate Recovery magazine called Recovery Campus. And then some of the highlights of that research were put into an article in the Recovery Campus magazine. And one of the exciting things about that was that the tagline of the cover of that magazine said, what's on the top of this slide: community colleges are the next frontier of collegiate recovery. And so if you think about these other 250 or so collegiate recovery programs all across the country, And then you see this small handful that are in community colleges all across the country. And you're going, well, almost half of all colleges and universities are actually community colleges in the United States. And yet, so we got 240 collegiate recovery programs in 4-year and university settings and college settings. And we just have like 10 or 15 in community colleges, even though community colleges make up almost half of all the colleges and universities in the country. And so we think that there's going to be a good expansion in this area. We're hopeful that even by people seeing this webinar, that more community colleges will be excited about expanding. I always think about higher education access and where people might start their higher education careers, and what's the likelihood of people in their recovery that oftentimes are inspired to go to college and might start their college careers at a community college, that there might be a slightly different percentage of students in recovery that start college at a 2 years college or a community college, as opposed to going straight into a 4-year institution. And again, I think there's a little bit of research out there on that subject. I just don't have that data at the tip of my tongue. We do know that from some of the surveys that happen, that a high percentage of community college students have been affected and have been affected in one way or other by substance use, like 83%. That's a very high percentage. Of course, I think in the broader society, the numbers are probably bearing out similar rates, that most adults or young adults or adolescents know somebody that's had a problem with substance use disorder these days. So, a few other facts are like, students know other students that are in recovery and definitely know other students that might be struggling with substance use disorder. That's true in community colleges, and that's probably just as true in other colleges and universities as well. The thing about community colleges is there is a high rate of turnover. So, as we start to think about, well, how do we make our community college CRP, how do we make our collegiate recovery program go? One of the things that we do is we stay in a constant mode of sort of recruitment and development, because students are coming and going at twice the rate of 4-year institutions. So you have that leadership transition and so forth. I think there's been a great level of commitment at our particular university, which is just it's the most ethnically diverse college or university in the state of Minnesota, our little community college is. And within that, one of the things that I think our institution has come to realize is they've had to make a strong commitment to diversity, equity, and inclusion. And so while we strive to have a strong representation of diversity within our collegiate recovery program as possible, just like the field of collegiate recovery, oftentimes collegiate recovery gets seen as a Eurocentric type of model, like it's a white program in a diverse world, right? And so I think all CRPs are striving to strengthen this area. And it's definitely something that we talk about at Minneapolis Community College and in our collegiate recovery program. And then, so we're going to look at a short video in just a second, but we have these pillars, I think, that are also important to recognize. And you can see from my background in my virtual background is the emblem that makes up our logo, and it's on my t-shirt, so you can see it on my t-shirt. And we have these pillars of collegiate recovery that talk about recovery, community, and education, forming kind of like the pillars of collegiate recovery, maybe all across the country in all collegiate recovery programs, but we've definitely highlighted those as our pillars here. And we started just, we're in our 4th year, so we're just over 3 years old. I think my slideshow wants to keep going with or without us. Um, and so we started off in a small room that was bigger than, just a little bigger than a private office for like a one-person office, and it had enough room for a table and a computer on the side. And so we had this small grand opening. The space that the institution committed to the Collegiate Recovery Program was a small space to get started. We didn't realize how quickly we would outgrow this space. But because of the enthusiasm of our students in recovery and the engagement of the institution and students from inside of Collegiate Recovery, students that were in recovery, and other student organizations that were our collaborative partners, we outgrew this space in like the matter of a month. You know, it was, as soon as we get together, the space would be overcrowded. Anyways, so our institution is, you know, roughly 10,000. It's a little smaller with the decline in enrollment. Started a little before the pandemic, and you know, but roughly 10,000. We know that in most colleges and universities, you're going to see a fairly high percentage of people affected by substance use problems. And so we said that we would anticipate there are a lot of students both with substance use problems and a lot of students that are in recovery at our campus. We also have an academic program that trains people to help people with substance use disorders. Like we have an addiction counseling training program here. So about half of those students are also in personal recovery. So we also had this sort of built-in cohort of people interested in getting recovery support on our campus. And one of the things I think we've all tried to do is expand the collegiate recovery membership beyond the specific academic program that trains addiction counselors. And so whenever we get a new member to our collegiate recovery program that's not inside of the addiction counseling education program, we also jump up and down for joy. Anyways, I was telling you these numbers just because I wanted you to know that Texas Tech University, which is like one of the big 3 collegiate recovery programs in the entire world, and has contributed to the development of collegiate recovery all around the world, has some documents to help you establish your collegiate recovery program. And inside of one of those startup documents is some math equations that would help you predict prevalence of substance use on your campus. And so we use that to establish the need. We use their formula to say, well, here's the prevalence issue at our campus. But we also did a side-by-side survey through our health clinic. And once you know those numbers came out to be virtually the same, like we could have just relied on the prediction formula from Texas Tech. Because when we actually took actual survey data from our students, the number was virtually the same. Like the same prevalence rate came from an actual survey versus a predictability formula. So putting all that together and then talking with a few key figures on campus, like our finance and admissions people, to look at why people left the campus in the first place. Well, we know there's a high level of attrition attributed to substance use disorder, meaning students leave college because they have substance use problems or don't find recovery support at a fairly high rate. So when you analyze your students that don't complete your programs, substance use is probably a contributing factor. And we had a new president come in just when we were starting our collegiate recovery program or trying to launch it. And she said, well, we can do something about the issue or we can leave our heads in the sand. So, you know, and how true is that of, you know, how we address problems in our society, you know? there's a lot of research on the impact of collegiate recovery programs, and to also justify and also to talk about the effect afterwards of establishing a CRP as your numbers come in from members who participate in your CRP. Then you can start to contrast, well, how do the students that are in your CRP do with overall academic success, with recovery and life success, compared to students that don't participate in the collegiate recovery program. And virtually all of the literature says that there's a benefit to having a CRP. But you can go out there and do the research yourself. You will be hard pressed to come across some literature that says a CRP is counterindicative to what your college and university is trying to do for students. They always have a positive impact. Right? The investment, that's where some challenges come in, I think, for all institutions. How do you get the resources? How do you establish those resources and sustain those resources to maintain a collegiate recovery program, even though it benefits your population, it benefits the population's outcomes, it benefits the welfare of the institution. All these things are benefits, but finding the resources to maintain and sustain can still be a challenge, because it's on the side, right? It's a supplement, or it's a support. So it's not a direct academic program, which our institutions are so invested in. So I think I talked a little bit of just, there's lots of ways to adopt a CRP, and there's several types of collegiate recovery programs at non-residential campuses, like most community colleges are. Then you're going to have a type of you're not going to have a residential collegiate recovery program. And so we established a model, a collaborative model across the institution that involves as many departments as we can engage to help sustain the collegiate recovery program. And then we have kind of a drop-in center model. So we have a model, peer-based model, and the peer-based model is supplemented by the support the institution kicks in, which is a little bit of time from a coordinator, a little bit of time from a co-coordinator, a little bit of time from an administrator, and we kind of put all that together, and then we collaborate internally and externally to find other resources. And so we'll talk a little bit more about that. But anyways, the way you would start any new program inside of an institution is getting some institutional support. First you're going to do somewhat of a needs assessment and figure out, do you need that or want that? And then you're going to try to gather support. And then you're going to try and gather resources, and then you're going to try and develop the model that you want to have, and then you're going to try to establish or launch a program. So there's plenty of literature on how to start programs. And again, I just refer back to the Texas Tech model because it's published and it's accessible for folks to look at a blueprint, a set of manuals that gives you some guidance in these areas that you can sort of pick and choose through their table of contents and their menu to say, well, I want to, use this part of how they establish CRPs, and this part doesn't apply. And then we have to make it unique. So then we're going to just go beyond whatever Texas Tech suggests, and we're going to talk to other folks from the ARHE, and then we're going to talk to our internal and external stakeholders, and then we're going to make our own CRP. So anyways, by the book means you could use a published model to at least get the ball rolling. When I did a survey of a few collegiate recovery programs that were in existence to help launch our program, one of the things they all said is, don't do it if they don't give you resources for a staff position. Well, if I took that advice, we wouldn't have one, because the school didn't have resources for a staff position. But we still wanted the CRP, and we still think the CRP is beneficial. So the way that we've done a sort of interdepartmental collaboration to establish resources to 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 staff our CRP is something that we feel like is innovative. Might be somewhat unique to our institution, but I'm not sure. And I guess one of the ways that we did that was this. My colleague that's on the line, that's going to talk in a few minutes. She really has a way of finding resources inside of the institution for student support, and she's the director of like student life. So she's connected to the institution in lots of different ways than I've connected to the institution as a faculty member. So she leveraged her resources and then got with her supervisor and said, well, let's park the program under student affairs rather than under faculty and programs, academic programs. And so that kind of opened up some different types of resources. And then we got some more buy-in from this other chain of administrative command. And then we started leveraging relationships with the clinic. There's a health clinic, and then with external entities like AmeriCorps, and all of a sudden we received a grant. Not all of a sudden, we applied and received a grant from AmeriCorps to have a recovery navigator on our campus, and then a little bit of my time from the faculty side of things, so I could have a few hours of my time released from academic credits to support services. But that was all a collaboration with student life and student affairs as well, because the resources, when they're not academic for a faculty member, they have to come from somewhere. So those were tied to like collaboration with the student government and student life, and just a innovative way to find a little bit of resources from a lot of different places to have a fairly robust staff. I mean, people I think are envious of the amount of time we have, considering we don't have a full-time person dedicated. And the other thing that Tara was so phenomenal at was tying our program into work study. So most colleges and universities have students doing different jobs on their institutions. And one of the jobs on our institution is to be like a recovery support specialist inside of the CRP. So we try to have a criteria. If a student wants to be a work study person in the CRP, they have to care about recovery. They have to have some kind of commitment to supporting recovery, either personally or both professionally, or just have interest in that area. And so that's another way we got like 40 hours of up to 40 hours of student time, and then this collaboration with AmeriCorps, Recovery Corps in Minnesota. Then we all have another full-time person. So now instead of having one full-time person, we have two full-time persons, and we still have a little bit of my time and a little bit of Tara's time. So some ways we're very well staffed, even though we didn't get direct resources to be well staffed. We found it indirectly. And then the clinic, the health clinic, who provides mental health services, we worked with them over the year of implementation. And so they put a little bit of extra resources in from the student health services part of student fees to expand the therapy that the health clinic provides to campus, to have an addiction specialist in our health clinic committed to the Collegiate Recovery Program. So if a student was, say, struggling, or maybe their substance use disorder returned after they've been in recovery, or just in engaging in recovery support on the campus, they wanted to talk to a therapist for a little bit too, we have that resource as another one of our innovations, to have a little more coverage for clinical support for students in recovery, as part of our collegiate recovery community and program. This is our logo. That was designed by one of our faculty members, made a painting. We got all this input about recovery. And then we turned it into, we worked with a community organization, got it turned into our coin. So students receive a coin when they they pledge their membership to the Collegiate Recovery Program. They get coined in and not coined out. They get coined in. So we're super excited that somebody could, carry the coin with them when they become a member. It's another way to acknowledge being a member of the community. It's just a picture of, a couple years ago, kind of like halfway through our existence, because we're just a little over 3 years old, 3.5 years old, that we had all these students participating in some of our different programming. But I love the picture just because of the diversity it represents. And just like lots of institutions, our diversity and our membership, I think it kind of flows and ebbs and flows up and down. Even though we feel like we have a strong commitment, it's something we talk a lot about. But this picture definitely captured a beautiful representation of diversity here at Minneapolis College. I don't think anybody in our Collegiate Recovery Program would argue that we love recovery and that we think recovery loves us. One of the things that came out of student participation is one of our alumni now, Christopher, when he was here, did a project with ARHE, with a grant from ARHE to students across the country. I think it was a leadership in recovery and education grant that was being done by ARHE and a collaborating partner. Anyways, he got this grant and collected recovery narratives and published a book, a little monograph of recovery narratives that came out of our Collegiate Recovery Program. And so we have that book. We're really proud of it. And then now we're doing something to collect more narratives, and then we're hoping to get Chris back involved with another author or another contributor to update this monograph with some more stories. But those stories are so powerful. To hear stories from people that benefited from having recovery support and going through school, or seeking recovery support and going through school, or finding recovery in school, and then hearing those narratives, it's a powerful piece. Something we're really proud of, because again, at least I see ourselves as this little community college with this little small collegiate recovery program doing big things. So we have this integration model, and I'm just about done talking. We have this integration model. Wait, let me see something. Oh, I think I was supposed to pause here. Anyways, I was supposed to pause here back at this slide. And give people a chance that are involved with our Collegiate Recovery Program to say a few words. So I see we're roughly 40 minutes in. We're doing great on time. We have about 20 minutes left. And I think there's 3 or 4 people here that were going to say something about their roles, the impact that their role has had on our Collegiate Recovery Program, and the impact that the Collegiate Recovery Program has had on them. So at this time, I want to pause, and then I just want to acknowledge if Tara's on the line, and then Charla and Sylvia and JP. So there's 4 people. Sylvia, Tara, Charla, JP. Yeah, I'm here. There might be somebody else, but would you like to start off with saying something, Tara?
You bet. Thanks so much, Jonathan. I appreciate the props that you already shared earlier. And I think some of the keys to our success you've already highlighted, but really is collaboration, innovation, and resourcefulness. And I feel like we're on our way to $1 million program, even though we don't have $1 million yet. And it's been so fun to be a part of this group. I've worked at the college now 15 years, and I've been able to partner with both our addiction counseling faculty and the addiction counseling club. And so we've really had a strong recovery community, but it was smaller and focused, no surprise, on those students that were training to become addiction counselors. And so it's been really lovely, as Doc mentioned, for us to see that grow and expand out into the rest of the college, because I think there is a lot of magic. Recovery loves our community. Our community loves to support folks in recovery. And, you know, the more we can spread that, the more we're spreading that recovery and that love, that community, that education that we're all about. And I think you already talked about some of our key contributors, but I just want to highlight that our health clinic has been such a great partner. For 10 years, we've been working with the University of Minnesota. So we're really blessed and lucky to have that collaboration that's really strong, and the ability to grow it, change it, evolve it as we need. And I think we have Becky Nordine on the call, and I think you might have given me some props for things that she helped us with. So she's our fearless Dean of Students, and we couldn't do it without her. She's often behind the scenes, one of our secret weapons. And thankfully, we have quite a few of those folks that really are just kind of our angels for the program, wanting the best, trying to help us any way they can. And in my day-to-day role, typically when we're on campus, my office is right near the drop-in center when we're, kind of in the permanent space. And so I get to be a support for resources and some of the things that might emerge. And then I'm really fortunate to be the supervisor of our student employees. And that's something that's a role that I take on with multiple different teams. And so it seemed like, seemed like a nice way for me to contribute and give back to this community. And so maybe that's a good time to pass it on to Sylvia, who is one of our superstar student workers and currently supporting not only our Minneapolis College Collegiate Recovery Program, but ARHE as an intern. So you just see those collaborations blossom and grow, and it's beautiful. So Sylvia, I'll pass it to you.
Thank you, Tara, and thank you so much, Doc. It's so wonderful to have these parts of my life intertwining, and it's just so. I'm so glad that this could happen, that my work as a student worker in the Minneapolis College CRP, and then also my work as an intern for ARHE. This is just a nice, it's a blessing really to have this webinar. So in my role at Minneapolis College, I run our all recovery meetings alongside Charla. I also help develop with another student a kind of Al-Anon-esque sort of support meeting called Friends and Family of Recovery. I'm also available for drop-in support, and I have a lot of resources at my disposal for students in recovery. I think it's just it's been so magical and really, really eye-opening to learn more about collegiate recovery, and then how special it is to have it at a community college, but then also looking at how many universities and institutions don't have that kind of support. And I really appreciate that I'm amongst people who are in the work of normalizing recovery on campus, normalizing a campus culture of students who want to live a sober lifestyle or are curious about the recovery. And so it's been really just a joy to be a part of that. And I feel that like it's deep in my own recovery as somebody that's in long-term recovery, to be in fellowship with other students and to kind of talk about like the specific stresses and triggers that being a student in recovery, like those experiences are so unique. And being able to share that, I know that a couple of the folks that typically we would have our all recovery meetings right now, and some of those folks are on the call right now. And so it's just been such a joy to be in recovery support with my fellow classmates. So yeah, with that, I guess Charla has been instrumental in teaching me about how to do my job, and has done so much incredible work herself. So I will pass it along to Charla.
Thanks, Sylvia. I'm Charla. I'm a student at MCTC, and I'm also the recovery navigator. When I started at MCTC as a student, I didn't even know that there was a collegiate recovery program, and stumbling across that resource for me was huge. It has made such an impact on my life, and this is prior to even starting as the recovery navigator. just with building friendships and being able to, like Sylvia was saying, connect with students who know the struggles of being in recovery and also being a student. Those aren't typical conversations in normal recovery meetings, I would say. And so it's definitely a close-knit group that we have to be able to share those things with each other. I started as the recovery navigator in January 2020, right before the pandemic hit. And so I've been on a long haul with the virtual learning versus virtual work. And, you know, Doc didn't really mention this, I don't think, about the lower participation we had when the pandemic hit and how much our CRP has grown since that began. And just seeing that has been super motivating for me as a student worker, being able to utilize all these different platforms to bring more students in has been amazing to watch. I just recently started a project with the Recovery Corps Opioid Response Coordinator over at Metro State. And so I don't know if there's other CRP members on this call right now, ARHE CRP members, but if you can be on the lookout for some surveys coming out to you, we would really appreciate being able to gather that information to keep our participation growing and keep members coming in. And we've gotten a few responses so far, but we would like more if possible. So I can pass it to JP.
Thanks, Shanna.
Hey, everybody. I'm also a student of MCTC in person long-term recovery. When I started Minneapolis College, I didn't know either that, just like Charlotte, I wasn't aware of the CRP program. But, you know, it was when I found out that they had a collegiate recovery program, I pretty much was all in, because it was something, you know, I basically want to wrap my life around recovery. And as I was going through the CRP program and seeing people also in recovery, and even the people that I met like in NA or AA meetings and stuff like that, you know, we was all in the same program, addiction counseling program, and it was good to see familiar faces and have that support, you know, basically supporting each other. And as I was going through the CRP, I learned that the opposite of addiction wasn't sobriety, but it was human connection. And we became a close-knit group, supported each other and rooted each other and pushed each other on. And it made me reevaluate what I wanted to, evaluate what I was trying to do in my life as being an addiction professional. And that the CRP and the school and the support for the mentors and Tara and the professors and stuff like that pretty much motivated me to start my own recovery community organization, the Minnesota Hope Community. So, you know, and you know, because basically that's just like the CRP was there to support me and we was there to support each other, and you know, me support other people is the same pretty much what I want to do as far as within my life and people in recovery and people experiencing addiction. So that's, you know, I got a lot out of the CRP and I still do. I really miss it. I don't kind of miss it at all. I really miss it. And I appreciate the staff and the faculty, you know, and Tyra and Doc and Taylor, you know, for supporting us, you know, within our recovery as well as within the addiction program. So, you know, it meant a lot to me, and it pretty much turned my, you know, turned the way that I looked at people experiencing addiction around. And I think the CRP is probably a very good resource for anybody that's in college that's within recovery.
All right. Thank you all. I don't know if I'm missing anybody that is here that is from Minneapolis College that was going to share. I think we might have got everybody. Anyways, okay. So let me just go forward here just a little bit further. got myself out of presentation mode on my screen. So we definitely talked about the integrated model, and then hearing from everybody. Thank you all for participating and just sharing your perspectives. There's so many things that I think we would want to say if we had more time. But for instance, we've had this way of making it through the pandemic that I think some people just got done referencing, like Charla and Sylvia. But when Sylvia said she's available for drop-in support, which Charla does as well, they created a virtual model. So, we had kind of the pandemic hit and we had to shut everything down and people couldn't see each other anymore. And our campus basically closed and we went 100% virtual. And so everybody got cut off and so quickly over the rest of that semester from last March till May and then over the summer, the team really started thinking about the innovation they could apply to providing recovery support in a virtual setting. And so when they said, well, I'm available for a drop-in meeting, because they published a schedule that went out to the institution. And the schedule of, how people can connect with recovery coaching, in a virtual setting. And then same with the meetings, like these all recovery meetings, they were having face-to-face. And, before the pandemic hit, we had 50 people on our roster and 20 active students. And, we had a pretty robust program. And the pandemic hit, we went down to there was 3 or 4 people standing, trying to figure out what the heck we're going to do now. And so then they said, well, let's make virtual meetings and let's make hybrid meetings. So we'll have a few people coming in with social distancing, masks on, sitting across the room from each other. And then we'll have the Zoom on at the same time. So we'll have the meeting kind of like a hybrid get together. And so, these are ideas that the innovation of students in recovery came up with. It wasn't like Tara and I came up with all these ideas as staff members and told our students, this is what we should do. They were like, let's do this, let's do that. And so to me, it's just another example of how meaningful having a program like this is to our institution. And then out of all the different student life organizations that were providing different support services to students during the pandemic, the Collegiate Recovery Program is like one of the only ones that really kept going the whole year. Everybody else are stopped and shut down and they're trying to figure out how to bounce back now. And, we had the Bike Collective maybe, and 1 or 2 other programs going, but I'm sure Tara could say more about it. But the recovery support programs, they're one of the only ones that made it through. And then so bouncing back in that way from the pandemic and thinking about the innovations. And we have a short video I probably won't show, but it'll be in the link just because we're running out of time and I wanted to save a couple minutes for folks. But I think we've done things like the students that hung on, kept working their active programs and supporting each other. And then that we created a couple outreach models so that we re-engaged students virtually. And then all of a sudden we saw, our membership start to increase again. More people signing up to be members of the CRP. We're passing out our, virtual coins, like they're mailing them to people's houses so people can get their membership coins. And we're going to have a virtual ceremony pretty soon. And so we've done things like that to see the program bounce back in the midst of this pandemic. And so, and now, now it's like we're planning for how we're going to come out of the pandemic and sustain some of these virtual innovations, and then reinstitute some of those face-to-face techniques that we had going to make our program and keep our program robust. Something else I didn't mention too is we have an annual event for our campus to battle stigma and support recovery. called Operation Recovery. And so we've been doing that for even before we had our CRP, but having the Collegiate Recovery Program really enhanced that Operation Recovery event, which is a Recovery Month event that's celebrated on our campus. And we're going in like our 12th year of that, but the last 3 years with the Collegiate Recovery Program being a central partner to our annual recovery event has just made it that much more powerful. Anyways, so those are a few things that I think we've done to survive the pandemic. And really anybody that's had concerns about COVID, they've been able to reach out not only to administration to get support and the health clinic to get support, but we haven't had any incidents where somebody got COVID as a result of participating in the CRP. And so that's another thing to be aware of. It was just a couple of pictures of a few things that we have going on. ARHE, which I've talked a lot about. And then, there's a couple of references or resources on here, including our campus link, which was another innovation that we worked really hard on this year being in the pandemic. So the link to the support services and the Collegiate Recovery Program was definitely enhanced over this last year to have this video that I made reference to. It's a short little video about the Collegiate Recovery Program and a membership application, which people used to have to get physically and handwrite, and now they can do that online. And so to me, that's a response to the pandemic, where our CRP and our innovative students and staff team came up with a way to engage students, even if they couldn't have a face-to-face, application process and all that sort of made the resurgence or the bounce back of our membership really grow. So it's like, we're knocking on 20 members again. And, we went down to just less than a handful of people still, holding on when the pandemic hit. So anyways, hopefully that spotlight on our amazing Collegiate Recovery Program here at Minneapolis College is both inspirational to the broader ARHE community and to other colleges and universities around the country, and to individuals thinking about going to school and that are in recovery and having some support at college for your recovery. That Patrice O'Mary said, we don't want people to have to choose between going to college and being in recovery. We don't want people to have to choose between those things. We want that choice to be mutually inclusive of each other so that people can have recovery, happy, satisfying, hardworking recovery, and happy, satisfying, hard work college experiences at the same time. So thank you all for your participation. I don't know if there's questions in the chat room or not, or if anybody had any closing comments, but we're right up against that 1 o'clock hour. And we thank you. Minneapolis College is glad to be a member of ARHE and to be spotlighted here today. Thank you.
Thank you so much, Jonathan. I don't see any questions that have come up. But if anyone does have any, could you type them into the box now, although we are pretty much at the end. We've got one question. What are some ways that people can get involved?
Involved in recovery and higher education, of course, is knocking on ARHE door and getting involved here at Minneapolis College. If you just go to the Minneapolis College website and then you can put in our search Collegiate Recovery Program, it'll go to our little link on the web page, and then there's contact numbers, there's phone numbers and email addresses for people to connect. And then by getting involved, if you want to get involved by your own personal recovery, or you want to get involved by supporting the Collegiate Recovery Program, there's definitely leads there to do that. And I think same with ARHE as a whole. Just get in touch with ARHE. They have a contact box there. Say you want to get involved with recovery and higher education, and somebody from ARHE will reach back to you in short order to find how you want to get involved. But I don't know, people in recovery that are going to school, you know, being out and talking about and looking for support for recovery on your campus, and then voicing where you see gaps and holes might be a way to initiate collegiate recovery efforts on a campus that doesn't have a formal program.
Wonderful, thank you. Well, I think that brings us to the end. I think that's all we have time for. We hope that this session has been helpful to everyone. A big thank you to Jonathan and the team for giving us your time today. We hope that we will see you on our next webinar, which will be on the 23rd of March at 2:30 Eastern, which is an interview with Monty Ball. Thanks everyone and take care.